Hi everyone, welcome to the Lakeview video podcast series, and I'm pleased today to be with Todd Orme and Summer Kaafarani with Waterford Academy out of Richardson, Texas. Good to have you both here.
Thanks for having us, Gina.
It's great to have people from Texas and Jacksonville, because Jacksonville is one of the largest landmass areas, and Texas is like the largest state in the country, so there's some similarities right there.
Best state in the country.
Ah, that is right. There you go. There you go. Yep. Go big or go home, right?
That's exactly right.
That's good.
Yeah.
Well, we're here today to talk with you a little bit about Waterford Academy. And Todd, you actually launched Waterford Academy.
I did.
And so tell us a little bit about that.
Well, I had an opportunity to move to Texas and start my own treatment program. Basically, it's a culmination of all my experience in treatment. It's where we've met before. I've worked with adult programs, both outpatient and residential, and this was my chance to do my own program.
Great. And so it's an adolescent program.
Yes, we're ages 13 to 18 for the primary day treatment and IOP, and we're now just starting a launch program for kids 18 to 21.
Okay.
For kids who are just struggling getting started with their lives and progressing to that next step.
And so Summer, you're the clinical director for the program.
Correct.
What's your background? Tell us a little bit about that.
I'm a licensed professional counselor supervisor, and my background, I started out in community mental health with adults, and then I ran kind of a similar program, a PHP and IOP for mental health primary, and then from there worked with a psychiatrist to develop, another adult program. But my passion's really in helping adolescents and teens, and so, this was a very good opportunity to get to do that. It's just a niche, and these kids are special, and
Oh, they're a handful.
yeah.
They are, even when they're
But
not,
it's
struggling
challenging.
with addiction. I think
Oh,
that's going to be a
absolutely.
handful.
Right.
So what are some of the common issues that you're seeing with adolescents when they come into Waterford?
Obviously we're a primary substance abuse, so that always is, part of the issue, but we see a lot of family discord, we see a lot of peers, a lot of bullying, and really, this is how teenagers are coping with difficult situations that teenagers are in, so we're seeing a lot of co-occurring addictions. I mean, a lot of eating disorders, internet, all kinds of things.
I would imagine the internet piece is big because kids grew up on technology,
Exactly.
so trying to help
Xbox.
them focus, right?
Yeah.
Right.
Isolating, disconnected, and so.
And so how are you all doing things differently with your adolescent program? What kind of modalities are you using to help connect with the kids?
Well, it's a combination of CBT, but we also focus on a 12-step. We offer smart recovery.
Okay.
So we give kids a lot of options to find their way in recovery. We're not forcing them down one avenue, but the thing we do recognize is that these young kids are not addicts. They're self-medicating to a deeper cause. And once we can zero in on that cause, whether it's anxiety or bipolar or depression, then we have a shot at getting those kids to find new ways of life.
How do you engage the family in that process?
We do require weekly family therapy. If the parents are not willing to participate, then it's not a good fit for our program. Because especially with adolescents, it's such the dynamic is so important. They're living with them every day that it's something that has to be addressed.
Right.
We're not going to get better.
Yeah, we're not a drop-off program.
Do you all have an academic component to your program as well?
Yeah, obviously we don't want kids to get behind in school, so 3 hours of the day is school. So depending on where the child's at, sometimes we can start an online program, we can continue one from treatment, or some of the schools will send actual packets of work so that the student's doing exactly what they would do in their home school.
That's great.
While they're in day program.
All the work goes to the transcript.
Oh, good.
And we have a licensed professional counselor that's also the teacher, so if a child is struggling with anxiety or something, she can also process that on the spot.
Perfect. Well, so as somebody who's watching today, if they're a family member and they're trying to figure out if their child needs treatment, Todd, you've been in the industry a long time. You've helped usher people into treatment all the time. What would you recommend to a family member who's watching today in getting information or accessing treatment?
First of all, we offer a free assessment.
Okay.
Mom and dad have any concerns about what's going on behaviorally or even with substance use, they can come down, free assessment, free SASD, and a discussion with the kid on the next step. We do take insurance with Blue Cross and Cigna. We're a network. Work on the other plans as well. They take a little while to get a network, but we want kids, mom and dad, to have the peace of mind to understand what's truly going on. Our website is www.waterfordacademyllc.com. We have an 800 number, 866-439-0355. Come on by. There's no reason to find out what's going on.
That's great. Well, thank you both for taking the time to come to Jacksonville and to
Thank
share
you.
a little bit more about Waterford Academy. For those of you that are interested in learning more about Lakeview Health, we invite you to visit us at lakeviewhealth.com. Or if you know someone that needs residential treatment right away, please give us a call at 866-887-0142.